Well, joining me now is the Government Chief Medical Officer, Sir Liam Donaldson. Sir Liam, thank you for joining us this afternoon. Now, while we've been on air, we've discovered that a third person's being treated for the disease. The woman's in her 60s, a Canadian national who has recently been to affected area. She's been tested, she's been to Mexico, and she's in isolation at the hospital in Manchester. If her case or that of the two women in Scotland that Debbie Edward was just talking about are actually confirmed, are you confident you've got everything that you need?
Yes, I think at this early stage, to be able to identify cases on a one-by-one basis, treat them with antivirals and then treat their contacts is a very good position to be in, because potentially that limits the spread of the disease further. The problem comes when we get much larger numbers of cases coming in, when it's much more difficult to pin them down on a one-by-one basis. But our contingency plans take account of that. We're prepared ultimately for very large numbers. We may not have large numbers, but we're prepared to deal with them if we do.
And as with all of this sort of thing, prevention is the real key. Are you confident that just chatting to people as they arrive at Manchester Airport or Heathrow, as we've just seen, is enough? Shouldn't they be screened and tested properly?
Well, the screening that was done at the time of SARS, when millions and millions and millions of people were put through screening in airports in the Far East and in Canada, detected very few cases. The problem is that people can have the disease with very, very few symptoms. So if you put all your eggs in that basket, you risk becoming complacent. It's much more important to identify people who develop symptoms when they occur.
Sure. And finally, quick one, Sir Liam, to reassure our listeners and viewers. Have NHS Direct got enough resources to cope with what is likely to be a very significant stepping up of demand?
Yes, they have, and we've alerted GPs, and the important thing is if people have returned from Mexico, they think they have flu, stay at home so as not to spread it to others, phone your GP, phone NHS Direct, and there's a clear protocol in place to investigate you.
Sir Liam Donaldson, thank you very much.